Hey everyone, welcome to Medication Monday. This is where we go over a different EMT drug that we administer out in the field. We do it specifically in EMT drug card format. As always, follow your local protocol and scope of practice. Enjoy. Today's medication is called Tissue Plasminogen Activator, also known as TPA. It falls under the class of fibrinolytics and clot busters. Your mechanism of action is that it binds to the plasminogen at the site of the clot, and this converts to plasmin, which ultimately breaks down the clot's fibrin strands and ultimately restores perfusion. Basically, that was an eloquent way of saying that it busts open the clot. Your indications are going to be acute myocardial infarctions, STEMIs, acute ischemic CVAs, and pulmonary emboli. As always, before we get into dosages, make sure you're abiding by your local protocol and staying within your scope of practice. And just a heads up on TPA, it's not a medication that we carry on the ambulances, so it's not a dose that we usually know right off the bat, and it varies greatly according to whatever the indication may be, whatever you're giving it for, and what the physician's order is. This tends to be a transport medication, whether it be in flight medicine or ground medicine. Your adult dose is 15 milligrams IV or IO over 2 minutes, 0.75 milligrams per kilogram over 30 minutes up to 50 milligrams, and 0.5 milligrams per kilogram over 60 minutes, up to a max total dose of 100 milligrams. And like I said, this varies greatly from physician to physician and for whatever it's being given for. Your pediatric dose is just not recommended out in the EMS setting. Adverse reactions that could occur with TPA are GI, intracranial, and external bleeding, also bruising, abdominal pain, hypotension, nausea and vomiting, chest pain, and also reperfusion dysrhythmias. So one of the things that you have to be very, very careful with these patients that are receiving TPA is to not bump them or injure them in any way when you're loading them up into the ambulance or into the helicopter or plane. You have to be so careful with them because a small bleed can end up being deadly for them or just bigger than normal. Your drug interactions. NSAIDs, vasodilators, and other anticoagulants may increase the risk of bleedings. You're just potentiating the already potent effects of TPA. How it's applied. It is supplied in 50 or 100 milligram powders that require constitution with normal saline. A few side notes about TPA. This medication does require cardiac monitoring in the EMS setting, and that's mainly because it can cause reperfusion dysrhythmias. Also, be prepared for allergic or anaphylactic reactions because they can happen, so make sure you always have epi and Benadryl on the ambulance or wherever you're administering this medication. TPA is typically not carried in the 911 EMS setting at all, so if your patient is experiencing an acute MI or has suspected cardiac chest pain, EMS providers can meanwhile administer aspirin. The onset of clot busting is 60 to 90 minutes, and you have to be so careful with the packaging and moving of this patient. Avoid new puncture sites with these patients and monitor current incisions and punctures. The antidote for TPA is going to be TXA or aminocaproic acid. As always, guys, remember to abide by your local protocol and stay within your scope of practice. This video is purely informational for those in the EMS field and never meant to be used in the place of local protocol, formal education, or medical direction. Thank you guys so much for watching, and I'll see you next Monday. Bye!